Hello friends, this is Sonu and today we'll discuss about the vitamin D. As I discussed in last time, that was the vitamin A. So today we'll discuss about the vitamin A. As we know that the fat soluble vitamin, the four vitamins which belong to the fat soluble, that is the A, D, K and E. So A already discussed, today we'll discuss vitamin D, and two vitamins have to more discuss, that is the vitamin E and K. So let's start about the vitamin D. As we know that the vitamin D, it is the nutritional vitamin which maintain the nutrient over the body. In all vitamin also the maintain nutrition. So the vitamin D is represent in a two form. First, that is the cholecalciferol, or also we can say vitamin D3, and the second one, that is the ergocalciferol, that is the vitamin D2. Cholecalciferol we can get from the animal source, or we can get also within the human body, that is the skin. From the skin, whenever ultraviolet ray will expose on the skin, so it will eventually convert in the cholecalciferol. How it will be, we will discuss. About the ergocholecalciferol, actually whenever it will go in the blood, so it will eventually convert in the cholecalciferol. But in the initial point, from the, we can say starting, or we can say whenever the start to eat the cholecalciferol from by the mouth, on the time it is the ergocholecalciferol, but in a blood it will convert in a cholecalciferol. Now we'll discuss about the function. What is the function? The main huge function of the vitamin D, that is the maintain calcium and phosphate level in the blood. Actually it's a maintain the calcium, but calcium always move with the phosphate. That's why we can say that the calcium and phosphate level in the blood. And due to the due to the maintain the calcium, the function become further, we can say that the maintain muscles movement, because as we know that without calcium the muscles movement will not possible to contract. That's why it should be present in the normal amount. So that's why maintain the muscles movement. Second one, formation of the stronger bone. Obviously as we know that the bone need calcium, then it can be stronger, or we can say very good bone during the formation. Next one, it has anti-inflammatory properties. Due to the calcium level, or we can say the normal amount of calcium in the body can be role in the anti-inflammatory properties somehow, but not significantly. It has neuroprotective properties. From the neuroprotective properties, we can think that without the calcium level, the neuron become not stimulated. It will not do the well function, because low calcium level, the neuron become hyperpolarized, and we can say the shutdown of the brain system, brain neuron. That's why it has neuroprotective function, or we can say it maintain the cognitive function of the brain or the body. The normal amount of the vitamin D, that is the 9 to 11 mg per dl, and the normal calcium in a plasma, or you can say plasma level, that is the 8 to 10 mg in dl. In different books, little bit can be 8.5 to 10.2 like that, but for the understanding purpose, just I approximately take the 8 to 10 mg dl. Now let's discuss about that how the vitamin D absorb in the blood. I mean from the GIT, how it will go blood, and how it will start the function. So let's from the GIT and from the skin. So in the GIT is two vitamin, as I said. First vitamin D2 and second vitamin D3. Vitamin D3 from the animal source, like that the cod liver oil, fish liver, animal liver, and even egg yolk egg is very rich vitamin, I mean the calcium concentration. And the second one, vitamin D, it is a plant source, that is the yeast and green vegetables and other plants. So should I write here animal source, and vitamin 2 is the plant source. So from the first we'll discuss about the skin. In the skin we have naturally present, that is the 7 dihydrocholesterol, because the vitamin D is the, we can say, is function like the cholesterol like the function it will do. So in the skin, right here, I will write here 7 hydroxycholesterol. This hormone is present in the skin, and whenever ultraviolet ray will expose on the skin, by the help of the enzyme, it will convert cholecalciferol. I'm right, shortcut CCF, cholecalciferol, and then cholecalciferol will go in the blood. It is from the skin. Now we'll discuss about the GIT. So D2 and D3 will absorb in the GIT, and as I said that after the absorption, it will eventually make cholecalciferol. So here also cholecalciferol. Now the both cholecalciferol, which obtained from the skin and from the GIT, will go in the blood. CCF. But is still inactive vitamin. The both are inactive vitamin. We can't say that it's an active form. And from the blood, it will go in a liver. From the portal vein. So it will go in a liver. But for the activation, it need to hydroxylase. It need to the hydroxylation. So by the 2 hydroxylation, then eventually it will activated vitamin D. So the first hydroxylation, it have to go, or it should be go in the liver. And in the liver I have a special enzyme, that is the 225 hydroxylase. 25 hydroxylase. So now cholecalciferol already reached in the liver. And by the combination of these two cholecalciferol and 25 hydroxylase, it become 25 hydroxy cholecalciferol, or also this molecule we can say that is it is the provitamin, or we can say a storage form. Or other name is the calcidiol. So it is a provitamin, means whenever in the human body like us, whenever the calcium level is normal, so it in the physiological I'm talking about in a physiological functions, so it's already present or already live in the liver, and whenever calcium will go down, it will secrete from the liver and will maintain the calcium level in the body. How? We'll see. So now the cholecalciferol will already reach in the liver, and by the help of liver enzyme, that is the 25 hydroxylase, it make 25 hydroxy cholecalciferol, but it's still inactive, not active. Now, so first hydroxylase is done. For the second hydroxylation, it have to go in the liver. In the kidney. And in the kidney, very special enzyme. That enzyme is the 1-alpha hydroxylase. So now 25 hydroxy cholecalciferol reach in the kidney, and by the help of this enzyme, it form 1,2,5 dihydroxy cholecalciferol. 1,2,5 dihydroxy means it had the 2 times hydroxylation. Due to this reason, the name is dihydroxy. So 1,2,5 dihydroxy cholecalciferol now formed, and this is the active form of vitamin D. This is the active form of vitamin D. Or the second name, this enzyme called calcitriol. Here the calcidiol, don't confuse with the calcitriol and diol. Diol, which this synonym name we can say 25 hydroxy cholecalciferol, that is the calcidiol. But whenever it will activated form, that is the 1,2,5 dihydroxy cholecalciferol. Maybe in some question ask that which one is the calcitriol or which one is the calcidiol. So activated vitamin D is the calcitriol, this synonym name or other name calcitriol, and 1,2,5 dihydroxy, or we can say provitamin, provitamin or storage form of vitamin, that is the calcidiol. Now the vitamin D is already activated. Now we'll see that how it's act or how it's maintain our calcium level in the physiological conditions. So active form of vitamin D, first it will go in the bone, and from the bone, that as we know that the major storage of the calcium in the which is the bone. So from the bone, and in the bone, two types of cell, osteoblast and osteoclast. So whenever the plasma level of calcium become decreased, means the less than 8 or 10 mg per day, on the time vitamin D will go in the bone and stimulate the osteoclast, and osteoclast will eat the calcium and release from the bone. So now the calcium will go out in the plasma. First. Second function, it will go in the vitamin D will go in the GIT mucosa, and in the GIT mucosa it will bind to the mucosal cell DNA, and the, for example, let's make here, this is the mucosal cell, and the mucosal cell bind to the vitamin D. Here is the special receptor, vitamin D receptor. The name is vitamin D receptor, and vitamin D receptor will bind inside the cell, and it stimulate the gene here, that is the chromosome and nucleus, and make, by the help of the messenger mRNA, it will produce called binding protein, and this protein, whenever synthesize this protein by the help of vitamin D, it will very fastly absorb calcium from the intestine in the blood. So first function, in the bone it's release calcium by the stimulation of osteoclast. Second function, it will go in the GIT mucosa, stimulate the GIT mucosa DNA, and then DNA will, by the help of the messenger RNA, it will produce call binding protein. And call binding protein, the function of the call binding protein, it will lot of calcium will absorb, like the from diet, whatever calcium we're taking. So from the diet in the intestine, it will absorb calcium, and it will secrete in the blood to compensate the calcium level. Third function, the active form of vitamin D will go in the kidney. It will go in the kidney, and the first, it's stimulate the 1-alpha hydroxylase, means without this enzyme, without help of this enzyme, will not get active form of vitamin D, and then active form will maintain the calcium level. That's why in the kidney, in the nephron, will, whatever calcium is secreting by the urine, it will reabsorb that calcium and send in the blood. So third function is here. So this three function is done by the active form of vitamin D. Now another function of the except of the vitamin D. So whenever calcium, rub this one and we'll discuss. So we'll make again kidney. This is the kidney, and this is the bone. This is the blood circulation, and GIT we already discussed about the GIT. So whenever calcium will decrease in the blood, and as we know that calcium and phosphorus will always follow together. So whenever calcium and phosphorus will decrease in the blood, so calcium will go in the PTH. As we know that the behind the thyroid gland, in the in nearest the throat. So behind the thyroid gland, that is the parathyroid gland is present. So in the, and this cell is named the chief cell. So whenever calcium will decrease in the plasma level, calcium will stimulate the parathyroid gland. In the parathyroid gland is the chief cell, to stimulate the chief cell and secrete the parathyroid hormone. Now the parathyroid hormone, the main function of the parathyroid hormone, it will go in the kidney. And in the kidney, that is the 1-alpha hydroxylase, that's enzyme, that is a very important enzyme for the activation of the vitamin D. So it will active the stimulate this enzyme first. Second, it will secrete, we can say, for example, in the kidney, this is the nephron. This is the nephron. So once it stimulates the 1-alpha hydroxylase, first function. Second function, it will reabsorb the calcium. So it will reabsorb the calcium. But one bad thing, that it will excrete the phosphorus by the urine. Means it will stimulate that whatever phosphorus is present in the blood, it will excrete the phosphorus by the urine, and it will reabsorb the calcium. So what will be the bad thing about the phosphorus, we will discuss now. So two functions is done. First, stimulate the 1-alpha hydroxylase. Second, it absorb the calcium. Then it will also go in the bone along with the vitamin D, and by the stimulation of the osteoclast, release calcium. So by these three functions, the parathyroid hormone maintain the calcium. But one bad thing about the parathyroid hormone, that is the whenever calcium level in the blood is normal. For example, any person suffering from hypocalcemia, by the diet or by the drug, it will already compensate. Now the person is healthy. During the healthy, the whatever calcium will go out from the bone, it have to maintain. So again, that calcium and phosphorus will deposit in the bone whenever the person become healthy. But PTH, as we know that the phosphorus, if the phosphorus will decrease, for example, the calcium plus phosphorus, always these two components always together want to live. If the phosphorus will decrease or maybe calcium will decrease, it will not deposit in the bone. Even it will secrete from the bone, no problem. Without decrease and increase, it will from the bone, it will calcium will release. From the release, whenever it's have to release, on that time, not anyone that phosphorus will be maintained or not. But during the deposition, during the mineralization, the both calcium and phosphorus have to in equal amount. That's why if the phosphorus will decrease or calcium will increase in the blood, means the normal calcium level in the blood, but the abnormal function, or we can say abnormal concentration of the phosphorus in the blood, on the time it will not deposit or it will not mineralize. That's the parathyroid hormone as compared to the vitamin D, little bit bad. Why? Because vitamin D always maintain the calcium and phosphorus level, but the parathyroid will not maintain phosphorus, only maintain calcium. Why? Because it will excrete the phosphorus from the kidney, and whenever it excrete the phosphorus, the person is a hypophosphatemia, and during the hypophosphatemia, calcium will not deposit in the bone, and bone become very, we can say, loose, or maybe it's a very weak bone. That's why as compared to the parathyroid hormone and the vitamin D is much better. In some question maybe ask which one is better. So the function is almost the same, but one bad function that it excrete the phosphorus, but vitamin D will not excrete. It will maintain both calcium and the phosphorus. So during the bone, again mineralization, on the time vitamin D will help, but the parathyroid hormone will not help because it excrete the phosphorus. So these are the main, we can say, absorption and how it's maintain the calcium in the bone. Now we'll discuss that which types of pathology can be developed in a hypovitaminosis of the D. Whenever the calcium will normal in the blood, it will automatically compensate whatever calcium released from the bone during the in a healthy patient. So now we'll discuss about the hypovitaminosis of D. First, that is the rickets in a child. That is a very often diseases all over world, especially in where that sunlight is not properly come, like in a European country or in some African country, because the black people will not expose sunlight. That's why it's decrease the calcium level in the body. As we know that the major source of the calcium also, instead of the diet, means along with the diet, the ultraviolet ray, the morning, especially the morning sunlight. So rickets in a child. Second one in the adult, that is called osteomalacia, or we can say adult rickets. And the third one, that is the renal rickets. Actually, renal rickets, we can say that the chronic renal failure, whenever the both kidney will fail on the time, the renal rickets develop. How? As we know that in the kidney 1-alpha hydroxylase enzyme, without this enzyme, the vitamin D will not activate, and without we can say inactive vitamin will not do any function. That's why kidney have to must work very properly in a physiological conditions, in healthy conditions. So in a renal rickets means the chronic renal failure. Chronic renal failure can lead to the vitamin D deficiency because the enzyme will not work. So these three, we can say, main diseases. In the rickets, let's discuss about the rickets very briefly. In the rickets, what problem will be occur? In the baby, first, that delay formation of teeth. Then from the upper extremities to the lower extremities, the bone become abnormal. In our upper extremities, the frontal blossing can be appear. Then delay anterior frontal closure. So delay anterior frontal closure. Delay anterior frontal closure. And in the bone become, we can say, for example, this is the normal bone, but during the rickets, the bone become like that. This sap the bone. So also we can say ractic rosary. These types of symptom will be appear in the rickets problem. Or fracture can be occur, that is the green stick fracture. So these are the, we can say, very important or typical symptom which appear during the rickets. So we will discuss about during the rickets as special pathological topic on the time. This all problem will be written in the book. So now just very briefly, I told you that about the rickets. In the osteomalacia, the same thing. In the we can say in the adult person, the bone become deformities, weak bone, and we can say the pain appear in the bone due to the weaker bone. That's why. In the renal ricket, as I said, the chronic renal failure will lead to Why? Because and if the enzyme will not work, so without enzyme it will not active vitamin D and can lead to the vitamin D deficiency. So these are about the pathological condition of the hypovitaminous D. Now we'll discuss that how what normal level of the vitamin D have to take. So 400 international unit. International means it's represent the amount of the vitamin D in the international unit. So that's why international. So 400 international unit, it is the normal diet. Means every day in a healthy person have to take 400 international unit in every day. In child, who is growing means they're still in a growth, so maybe 400 to 800 international unit, but it's depend upon the child. Maybe increase or maybe decrease the amount of vitamin D, but in approximately it should be 400 to 800. On that lady, pregnant lady, or the lactation during the milk, baby will drink the milk, on the time 800 to 1200 international unit. In the old person, it is for the pregnant lady, and during the lactation it is the child, in growing child. Old person, that is the 800 to 1000 international unit. So 800 to 1000, because in the old person the bone become demineralized, start to demineralize. That's why the amount is vitamin D have to increase. So this is the we can say the amount that what have to take. One second, sorry. Now we'll discuss hypervitaminosis, means the toxic hypervitaminosis. Vitamin D also can be suffer those person who have liver disease, means this is the fat soluble vitamin, and if the liver disease means if bile will not secrete in a appropriate amount, so it will not absorb, means the fat for the emulsification of the fat need the bile, and this is the fat soluble vitamin. So if the bile will not in a normal amount, it will not absorb. So those person who have liver problem or bile problem can also lead to the vitamin D deficiency. And the chronic renal failure, as I said, can also lead to the vitamin D deficiency. So this all we can say important thing you have to keep in the mind, that maybe in some other pathological condition can lead to the vitamin D deficiency. Even in the fat soluble, a lot of in a bile deficiency can lot of problem can be occur, not in a vitamin. In all fat soluble vitamin can be interrupt, and some other function also can be interrupt. But this information keep in the mind. Hypervitaminosis can lead to first nausea, vomiting, after that thirst, very thirsty, then severe itching, can lead to can be appear. Then polyuria. Why the polyuria? Because the excessive calcium can be damage the last part of the kidney, that is the distal convoluted, and whenever its distal convoluted will destroy, or we can say necrosis will be occurred due to the during the hypercalcemia. And as we know that the antidiuretic hormone will work in the last part of the kidney, and it will be the absorbed. But how it will be absorbed? If their cell will be work properly. Let's talk about that. This is the kidney, and this is the nephron. So in the last part of the nephron, that is the distal convoluted, here work ADH. This is the ADH hormone, antidiuretic hormone. But for the working ADH, here the cell will work properly. This is the cell, that is the principal cell. So due to the hypercalcemia, this cell will not work, or this cell will be died due to the hypercalcemia. Can lead to the necrosis and can lead to inflammation will be there. So due to this is an ADH already secreted in a normal amount, but how it will work if the cell will not work? That's why whatever water is coming here, it will not absorb because the cell already died. So the water will go out, and that's why polyuria. And as we know that the calcium, vitamin D is the fat soluble, so it can be deposited in the all over the body in a very excessive amount. That's why it can deposit in a small tissue. So in a small tissue, deposit, and the small tissue deposits such as arteries, in a kidney, especially in a renal caliculi, and due to the deposit of the calcium, it become a very hardening, very hard. So hardening of the artery, we can say, and the kidney in a renal caliculi, it can lead to the stone formation. So in kidney, the stone formation. So renal stone can be occur in very prolonged hypercalcemia will be there. And in kidney, two problem: first polyuria. Why polyuria? Already explained. Second, stone formation. And some other neurological disorder can be occur due to the, as I said, that in very prolonged use. In the bone also can lead to the demineralization of the bone. Demineralization of the bone. So these are the hypervitaminosis, means the toxic molecule. And one thing also I have to mention that nowadays, as I said, that the vitamin D is the fat soluble vitamin. That's why nowadays, if any person is very severe lack of the vitamin D, or we can say very severe hypervitaminosis, on the time 6,000 international unit doctor will prescribe for the 1 week. Because it's a fat soluble, so it can be absorbed or it can be deposited in the our body, and day by day, whatever the need, it will go out and maintain the calcium level. That's why in a 1 week. But in those person who have very severe problem, or we can say very severely hypervitaminosis T. So now we'll discuss about the major source of the vitamin D. First source, about the two things: cholecalciferol from the animal source like liver and milk. One thing I forget to mention, as we know that bad news about the milk, that milk is very poor for the maintain the calcium level. Poor calcium. Milk have very poor calcium. That's why for the baby, for the children, the extra supplement of the vitamin D very necessary to give, because in the milk is not in an adequate amount of the calcium. It will not maintain the calcium level for the baby. That's why baby have to bath in the ultraviolet ray. It should be keep in the ultraviolet ray every day in morning sunlight. Give the another supplement for the vitamin D along with the calcium, along with the milk. So source of the first animal source like liver, like cod liver oil, fish, and very rich in a egg yolk, that is the yellow part of the egg. Then argocalciferol, that is the plant source. Plant source means the vegetables and yeast, because in the yeast the from the photolysis it can be make the vitamin D like in a tablet form or in a medicinal form, and can be give. So these are the main source of the vitamin D. So I think these are the all information about the vitamin D. So hope you will like, and in the next time we will try to discuss about the vitamin E, then vitamin K. So till then, take care. Thank you so much.